Welcome to the last Tisky Sour before Christmas. And I'm feeling comparatively festive compared to Monday, where I was feeling a little bit miserable about the options facing us. One reason is personal. It looks like I will be out of isolation for Christmas Day. That's because they've reduced the time that one has to stay inside from 10 to 7 days. I'll have to test negative on lateral flow test, but that seems to be going okay so far. On the more general level, we're getting some somewhat reassuring data out now about Omicron and how serious, how severe it might be. Lots and lots is up in the air. There's still lots of unknowns. I'll be talking to an expert about that later. I just thought I'd start with those two slightly uplifting stories, at least for me. I'm joined by Dalia. How are you doing?
I'm good. Michael, how are you doing? A little bit of change of scenery here. We're all sort of in our awkward, Christmas, moving around, being, with family stuff. So in case anyone's wondering why I have this gorgeous new setup.
I'm in the same place as ever. I bet you've been looking at that back wall of mine for months now. We are also going to be talking tonight about a Scrooge, someone who has made themselves a bit of a Scrooge, Rishi Sunak, not giving enough money to hospitality industries suffering right now. We're also going to talk about Nick Ferrari. He says it's a terrible argument he made about the NHS and Boris Johnson's polling. We do want to know your comments and your questions, so please do tweet them on the hashtag TiskySour or put them in the comments box. Straight on to our first story. As anyone who has wandered around London recently will know, or anyone who's spoken to someone who have, if you've been isolated in London, you will know that Omicron is more than capable of emptying our high streets and emptying pubs and restaurants, even without government restrictions. That's meant there's been a lot of pressure on Rishi Sunak to introduce extra support for the struggling hospitality and leisure industries, but he has dragged his feet. He was in California all last week. On Tuesday, he did step up. He made an announcement. He said there'd be £6,000 for every business in these sectors, as well as an offer to help cover sick pay.
Firstly, to protect jobs and businesses in the hospitality and leisure sectors, the government is introducing a new package of grants worth £1 billion. Businesses in those sectors can claim new, one-off cash grants of up to £6,000 per business premises. And we're topping up local councils' funding by £100 million so they can support other local businesses at their discretion. Second, we're making available £30 million through our successful Culture Recovery Fund to support theatres, museums and other important cultural institutions. Both these measures will apply in England, with funding available for Scotland, Wales and Northern Ireland. And lastly, across the whole United Kingdom, we're reintroducing our rebate scheme for statutory sick pay. Now currently, if someone needs time off because of COVID, it's businesses that cover the cost of their statutory sick pay. Under our new scheme, small and medium-sized businesses with fewer than 250 employees will be able to claim a cash rebate from government to cover those costs for 2 weeks for every employee.
So you've got £6,000 per business in the hospitality sector, and also the government will pay back businesses if they need to pay statutory sick pay, which is only £96 a week, the lowest in Europe. We'll talk about that a bit more in a moment. First of all, let's focus on whether or not this is enough money for hospitality bosses, for the people who run these businesses. Sunak, he seemed pretty smiley there. He thought it was generous. Bosses in the industry are less impressed.
I mean, it's better than nothing, for sure. But to be honest, it just doesn't touch the sides for our businesses like us and for us. I think with a 40% reduction in revenue, which I don't think makes us unique, I think that's quite typical across the board, we're losing a huge amount more than £6,000.
That publican speaking to Sky News was right. The revenue she had lost was not atypical. So the industry body says that the average loss over the past few weeks is 40 to 60% in revenue. You've got to remember that December is usually the sector's most profitable month. Workers have also got a raw deal. So that was the perspective of someone who runs the pub. What about the people who work in them, losing thousands of shifts? Collectively, cumulatively, because there are less people going into the businesses, going into the pubs. It was in this context that on Sky News this morning, Care Minister Gillian Keegan was asked, why haven't you reintroduced furlough?
Well, because people are still working. I mean, I went out for a family meal yesterday. You know, there was the pub was, not every table was full, but most of it was. You know, people are still going out and people are still enjoying themselves. So, you know, we're trying to get that balance again. But actually, most businesses I've spoken to are actually very appreciative of this support. So obviously you found one there doesn't think it's enough. You'll always find that. But, you know, this is £1 billion that we have just announced, and it is there to support businesses across our country, hopefully for a short period of time, until we can, get over this latest variant and the wave of disruption that it's caused.
That was Gillian Keegan saying, you got the one business owner in Britain who's not happy to have received £6,000, which for many businesses is about a day and a half's takings. So if you've got a third of people going into your pub, that's not going to cover it. She also clearly doesn't understand how bar work functions. She thinks if the pub is open, that means no one needs extra cash, but you'll lose shifts if there's only 25%, 40% of people going into the pub as usually would. Rishi Sunak, as I said, he said he will give a rebate for sick pay to businesses, but that remains at £96. So that means you don't have much incentive as a worker to get tested, because your sick pay is presumably going to be less than what you would have got paid if you went into work. This was a gap highlighted by Shadow Work and Pension Secretary Jonathan Ashworth, also on Sky.
Well, it's obviously better than nothing, and as you say, I think you in some ways answered it in your question. There's a bit of movement on statutory sick pay. I think the failure to pay people decent sick pay throughout this whole crisis has been a monstrous failing of the crisis. And you've now got people in low-paid jobs who are probably looking at their hours being reduced as well, because if they work in hospitality, because of the way in which hospitality has been so hammered, who are forced to make a decision about going to work or losing wages. And this virus spreads when people say they might be feeling a bit off, but they think, you know what, if I go and get tested and I'm positive, then I've lost money in the run up to Christmas. How am I going to get the presents? How am I going to put food on the table? I'm going to carry on going to work. That's because they don't get adequate sick pay. And I've been making this point for I was, as you said, I was doing the health job previously. From January of 2020, February of 2020, I've been making this point. Still hasn't been fixed. I don't understand why the government ministers cannot get their head around the very basic, simple fact that if you are low paid and you lose money if you are sick, you're going to try and avoid getting a test because you're going to need to go to work. It's very basic, and yet they still won't fix it.
That's a good point, well made by Jonathan Ashworth. That point was also reflected in the latest release from SAGE, so that's the body of the government's official scientific advisors, on a paper on non-pharmaceutical interventions. They said one obvious thing, that the government could do, which would make compliance much stronger than it currently is if you paid people to self-isolate, if you gave people financial support. The government still refusing. Dalia, I want to bring you in on this. And I suppose we've talked about sick pay a lot, so I actually want to focus on the hospitality sector specifically, and how, I suppose, pathetic it is, the amount of money that Rishi Sunak has coughed up for this sector. And also this kind of confuses me in a way, because people who own small businesses, it's not one of those situations where they're obviously Labour voters. These are people who might be Tory voters or might be swing voters. And yet Rishi Sunak is saying, oh, well, even if you've only got 40% of your custom, a few £1,000s should do. Look, in total, we're spending £1 billion. This is great. What are you complaining about?
I mean, I have never come even close to running a business, but even I know that £6,000 is probably going to cover you for like a day when it comes to hospitality. Like £6,000 when it comes to like business expenses is nothing. It's almost insulting. And the government is really, and this seems to be the theme of the COVID response, right? Which is this worst of both worlds model, where you're keeping things fully open so that bars, have to pay to keep the lights on. They have to, of course, pay their staff. They don't have access to a furlough scheme, whilst obviously not having the footfall to actually support those expenses, because it's probably not a good idea right now to go to a bar or a restaurant. It's against public health advice. But as you said, this actively disincentivizes workers from isolating or testing if they have symptoms. And that is because when you think about the fact that a quarter of Brits have less than £1,000 savings, and the fact that a lot of those people are probably going to be hospitality workers, and the fact that hospitality workers are generally more precarious, it therefore, and this is a particularly tight time of year with people buying presents, etc., it's inevitable that workers won't be able to afford to isolate. And so that is going to elongate this issue further. But it's also not really the business owners that are going to suffer from this. It's going to be the staff, because hospitality workers are incredibly precarious. And that precarity means that when it comes to the belt tightening that's probably going to happen from January onwards as a result of this loss of income over this Christmas period, it's the staff that are going to get let go. It's the staff that are going to lose shifts. And it's the staff that are going to miss out on those Christmas tips that they often rely on. But I think that question that you said about, people who own small and medium businesses, these aren't necessarily Labour voters. A lot of them might be potential Tory voters or swing voters. That's a really important point. And it's such a huge exposition of that key principle that the Tories market themselves as, which is, we are a friend to small and medium businesses. We're a friend to entrepreneurs, to small enterprises, because as you pointed out, it's the small businesses that are likely to be irreversibly hit by this. They won't be able to weather the storm of losing out on income, Christmas income, which a lot of them rely on, without adequate support from the government. £6,000, you might as well not bother. It's not the Starbucks, it's not the Pret-a-Manger's, it's not these massive chains that are going to suffer, although their staff might suffer, but it's not those chains that are going to have to close or are going to be put out of business. It's the small independent cafes and restaurants that won't be able to absorb that cost, and not just the lack of financial support, but also the lack of forewarning, the lack of, of giving people an indication of what the next week or 2 weeks might look like. That's also really important for crisis mitigation for smaller businesses. And so I think this is a really important opportunity for us to show that Tories like to present themselves as friends to small businesses, what they call in the US mom and pop shops, in order to give themselves a kind of cuddlier, more sort of down to earth impression of themselves. And because when you actually count in terms of, the number of businesses that exist in the UK, most of them are small to medium enterprises. They might not represent the majority of income, but they do actually make up a lot of businesses in this country. But that's because the key priority of this government is not actually about being friendly to those small and medium businesses. It's actually about maintaining this ideological war, which is that spending is bad, helping people with quote unquote handouts is bad, that paying people not to work, even if it means that they're keeping themselves and their colleagues, their co-workers, their clients safe, that is bad. And also that essentially the system that they design is to protect and provide a soft landing, and basically to make it only possible to survive if you are a Starbucks. That is the system that they have designed, that if you are a smaller or medium business, you're not going to be able to survive this, and then you'll probably be blamed for it because they like to individualize all of these issues. But the big businesses, the big companies, the sort of mega conglomerates, these are the ones that are going to be able to weather this storm. And this is not only bad for those business owners, it's also bad for us as a community, because it's those independent restaurants and bars and cafes that actually make our high street and actually make, our local areas nice places to live, rather than, a Starbucks on every street corner.
I mean, it's an interesting situation. It's almost one where I think trying to work out how the policy is internally coherent is quite difficult. And actually, I think what's potentially more persuasive is to just look at it as positioning inside the Conservative Party. So Rishi Sunak wants to replace Boris Johnson as leader of the Conservative Party. He wants to go into the next general election saying, I'm going to both slash taxes and I'm not going to increase the deficit. That seems to be sort of the identity he wants to create for himself. So he is being a bit stingy at the moment with money, genuinely. But then also, what do Tory backbenchers really care about at the moment? Coronavirus restrictions. They really don't want COVID restrictions. Rishi Sunak, by not giving financial support to businesses, makes it much more difficult for the government to introduce those restrictions, because obviously you can't really do one without the other. So if Rishi Sunak is saying, I'm not going to put forward any meaningful support for these businesses, then that makes it harder for Sajid Javid or Boris Johnson and the scientists to say, no, let's do it. So it could be that he's sort of forcing Boris Johnson's hand on that question, which leads me straight into the next story, which is kind of an update on everything we know about Omicron, what we've learned in the last 48 hours, because things are moving incredibly fast when it comes to our understanding of Omicron and how this informs the policies that our governments are adopting or not adopting. And to discuss those big developments, I'm joined by Oliver Barnes, health and science reporter at the Financial Times. Thank you so much for joining us, Oliver.
Thanks for having me.
And I was saying before we went on, I can tell Oliver's had a busy day because I've read, 2 or 3 of his articles today. That I really like the FT's pandemic reporting. We're going to go through sort of issue by issue. I want to start with the one that really brightened my day, which is the shortening of the time that people have to self-isolate if they test positive for COVID from 10 to 7 days. Lots of people delighted. That might mean they'll be out by Christmas Day. I have seen some people on Twitter say, oh, this is the last thing we need to do because there's already, COVID spreading. This is just going to create a few more possibilities. Why, Oliver, has this changed now? And is it a good idea?
I think it's basically a pragmatic decision. Obviously, with Omicron's kind of rapid spread, we went from a couple of weeks ago having never heard of it. Now it's, dominating the infection rates and our lives, I suppose, to a bit. The government's obviously having to contend with loads of workplace absences for businesses, but then also for essential public services. And that's because people have to isolate, right? So I think UKHSA did an analysis basically comparing how effective an isolation period is of 7 days ended with 2 lateral flow tests on day 6 and day 7, or a 10-day period with no lateral flow tests. And because lateral flow have their faults, but they're good at picking up on people when they're actually in the infectious period, shedding virus. So they're a pretty surefire guarantee. If you're in isolation right now, Michael, am I right thinking, if you take those lateral flows on day 6 and day 7 and you've tested positive on both, that's a pretty surefire guarantee that you're not infectious, and therefore you can go back out into society. And of course, that helps the government solve that kind of pragmatic problem, that there are loads of absences. This is why we've seen, issues with theatres cancelling shows. And then obviously that's even worse if that goes through to, essential public services like transport or the national grid or whatever.
It does add an element of jeopardy, I suppose, I think, to the isolation. Because one thing about isolation is you can just forget about everything. It doesn't, it's going to be a set. Now you've got to do your lateral flow in the morning. You're really tense whether or not it's going to be negative. Mine was negative this morning, so I am feeling very positive right now. But I know lots of people who have been testing positive for the whole 10 days, and I can imagine that being incredibly frustrating. Let's look at the next development we have, which is on severity. So lots of studies have come out in the past 24 hours in particular. Actually, they've sort of been flooding out. I want to go to a BBC update, which lots of people would have read and thought, wow, this is wonderful. So they report wave of Omicron appears to be milder, with potentially around 2/3 reduction in those needing hospital treatment. Preliminary studies in the UK and South Africa find. Oliver, that sounds pretty good, but I also know that the data that's coming out is incredibly complicated. And when I tried to read through it, I was a bit like, there's so much going on here. How can you make sense for us of the data that's coming out on the severity of Omicron?
Yeah, this is why my day's been so frenetic, because, it seems like severity studies are a bit like London buses. They all just kind of come at once. The main problem here, I think, that's confusing people is there are 2 issues at play. It's like severity intrinsically, i.e. this virus, an unvaccinated, non-immune person gets exposed to this. Is this a less threatening virus, and is it more likely to result or less likely to result in severe disease? So that's one element of things. And then the second one is when it interacts with our very, very immune populations. In South Africa, of course, that's mainly because of prior infection. In the UK, that's because of vaccination. How will it turn out in terms of infection to hospitalisation rates? What we can see pretty much from all these studies we've got in the past kind of 24 to 36 hours, that's a study from England done by Neil Ferguson's team, a study from Scotland, and also a study from South Africa, is that when Omicron does kind of hit up against and collide with a very immune population, the infection to hospitalization rate, so if you had 1,000 infections, how many hospitalizations you'd expect from that, falls. The reason for that, though, is kind of unclear. And one reason I've had posited to me by a number of experts is that because Omicron is able to cause breakthrough infections and reinfections at a higher rate, all the extra infections it would cause on top of Delta are effectively mild infections. So that makes the rate look preferable. The question that's left outstanding, of course, is whether some of this might be because of the virus kind of biologically changing to become milder. And there was a very, very slight indication from Neil Ferguson's research that was released today that perhaps it's kind of like in the ballpark of maybe 10% intrinsically milder, which is obviously great. The question that remains after that, though, is can that slight drop off in severity compensate for the insane levels of growth that we were seeing, well, particularly last week, but we're still seeing very high levels of growth in infections. And that's the kind of, in a way, the dilemma that policymakers are having to grapple with when they think about introducing restrictions or not.
We're all now used to hearing probably that the big problem with Omicron was that even if it is even 50% less severe than Delta, for example, if you have 3 times as many cases, then you still get more people hospitalized, because a small proportion of a very, very large number can still be bigger than a large proportion of a small number. And we were all, many people still are, many people rightly are. People are very, very worried about this because of Omicron's incredible transmissibility. But also looking at the numbers over the past couple of days, I've been getting, a little bit confused, wondering how to interpret them. It might seem weird I'm saying this because there was a record 106,000 new cases today. So a record has been broken. It's not like, the cases have gone away. But if you look over the past few days, and this is the date that cases were reported. So you've got today, it was 106,000. Yesterday, 90,000. Obviously, that's a big jump. But before that, 91,000. Before that, 82,000. Before that, 90,000. Before that, 93,000. Before that, 88,000. To me, we were told these cases are going to double every 2 days, or at least Omicron was going to double every 2 days. And, it's now a majority. I'd expect those numbers to be rising quicker than they are. Before I go to you, Oliver, I just want to show London as well. So in London, where Omicron hit first, so this is sort of the canary in the coal mine, as it were, it looks like cases could even have peaked. So on the 15th of December, there were 27,650 people who tested positive. So this is on the date of the specimen, so the day that the person did the swab. You can see there the grey bars. They're grey because they're incomplete. We're expecting more results to come back. Obviously, this is not good. It's not good to have 100,000 cases a day. But at the same time, when they said it's doubling every 2 days, I was expecting to see 400,000 cases by now.
Yeah, I think the point is, in a way, exponential growth, it looks terrifying, but it can't continue on forever. It has to at some point taper off. I expect there are a number of different things at play. In London, what we've seen is, I think, I live in South London, just looking amongst my friendship group, people in their 20s, behavioral patterns have changed pretty dramatically. At one point, I think in the space of about 5 days, 3 or 4% of Lambeth tested positive for coronavirus, which is just insanely high numbers. Once that kind of bad news got out, a lot of people adapted their behavior, and that has rode back the doubling times. It does look positive. There is one uncertainty, though. We can't be sure we've come to a peak because testing capacity is kind of so stretched at the moment. Everyone wants PCR tests, and PCR tests are the way we assess a kind of peak in infections and monitor that. And in a way, it would be very helpful if the government did give a pretty accurate assessment of how strained capacity is. We can only kind of estimate from, there are 600,000 tests you can do each day under Pillar 2, which is a community testing scheme, and then we can look at the number of tests being done. But we can't be 100% sure it's actually being strained. If it's not being strained, maybe cases in London have peaked. But that is a way the uncertainty that we have to deal with. The second thing is, a lot of those infection rises we were seeing, last week, the specimen data you referred to, when there was really high specimen, really high number of cases last week. A lot of those are already baked into hospitalizations that are yet to appear. So in London today, there was a record day for hospitalisations. There were about 350 hospitalisations in a single day. That's the highest since early February. We'd expect that to continue going up. And because of what we were talking about before, about that kind of unknown around severity, we don't know quite how it's going to go, how high it's going to go from the numbers that are already baked in. So we can take some kind of hope from it, but it's definitely not a certainty that we will be able to avoid restrictions because of this.
Which is why people are still talking about restrictions. So there were lots of announcements today and yesterday from three of the four nations. So we have new restrictions in Scotland, Wales and Northern Ireland. We'll go through some of those now. So in Scotland, from Boxing Day for 3 weeks, there will be indoor standing events, which will be limited to 100 people, indoor seated events to 200 and outdoor events to 500. In hospitality, the 1 metre rule must be observed between groups, and there'll be no crowds for football matches, because that would obviously go above 500, and pubs to provide table service only. In Wales, the rules are stricter. So First Minister Mark Drakeford today announced that outdoor events will be limited to 50, with 30 for indoor events. The rule of 6 will apply in pubs and restaurants, and it will be a legal offence to organise an indoor event with more than 30 people. That's significant because in Scotland, this is all based on restrictions on businesses and advice. In Wales, they're encouraging people to limit their household mixing, but it only becomes criminal. You're only subject to a fine if you have 30 people. In Northern Ireland, new rules were announced this afternoon. So again, from Boxing Day, nightclubs will be closed. Dancing at hospitality venues, excluding weddings, will be prohibited. The rule of 6 will apply in hospitality venues, again with table service. People will be urged to limit meetings inside. So those urgings are also happening in Wales and Scotland. Face mask rules strengthened. That's also happening in all of the nations. Obviously, if you live in England, you're probably aware that nothing so far has been announced in England, and we're still expecting potentially, some news in the next couple of days or on Boxing Day. It's unclear. Oliver, do you think that restrictions such as what we're seeing in Wales, Northern Ireland and Scotland are inevitable in England, and it's just the Tory party sort of sorting out its own internal beef? Or are there actual scientists saying that maybe we can get through this without introducing restrictions such as those?
Well, we keep on hearing from the government that they're waiting on new data, and this kind of phrase has slightly puzzled me because a lot of the data is already there in a way. The data that they are kind of waiting on is this severity data, and as we discussed earlier, even though it's a little bit positive, I'm not sure it will compensate for the really high levels of spread. I think one interesting indicator I was having a chat with this researcher who's on SPI-AM on the SAGE modelling committee yesterday, but he also works in Denmark, and Denmark have done a similar thing to Scotland. They've introduced, fairly not super draconian, but fairly draconian restrictions. They've, shut museums, various like cultural attractions, and limited mixing in restaurants, etc. And he was saying, in a way, the UK has kind of fallen, England in particular, of course, has fallen into this kind of trap that it always does of being quite Panglossian and, never taking preemptive action. I think the thing that would be bad with restrictions is, of course, if they come too late, because, they may actually not kind of have any massive effect on infection rates. I'm of the opinion that it's likely that the government will have to implement restrictions, just because even if that 100,000 figure isn't growing a huge amount, if it stays stubbornly high, it's uncomfortable and it could feed through into hospitalizations. But as you were talking about earlier, if London's already peaked, what are restrictions like doing in London? They will bring the peak down quicker, but they didn't actually avert us getting to that very high point. And it's of course the high point that doctors and nurses in the NHS worry about, because if you get a really high peak in cases, you can get all your kind of hospitalizations concertinaing together over like a week or 2 weeks, and it's that dramatic kind of pressure on the health service, which is what we talk about when it's being overwhelmed. I think even if we didn't opt for Plan B, it's very unlikely we're going to get the same numbers of people in hospital at one time. Back in January last year, we had about 40,000. January this year, rather, we had about 40,000 people in hospital at one moment. I don't think we're going to get to that, but it is possible we could near the kind of daily admissions figures from January, which were in the region of like 3 to 3,500. But because of the lower severity, the kind of length of stay will be lower, and therefore people will leave hospital quicker. All of this, though, just really creates this complicated picture for the government about how what the step is next in terms of restrictions.
Yeah, no, I mean, it's all. I mean, my big worry is that we don't have restrictions. Then it's at the point that the hospitals are almost overwhelmed that we sort of have to have a solidarity lockdown, because they're like, oh, we can't have images of people at nightclubs when there are people, coming off beds in the hospital, and then no one's willing to point out that actually everyone in hospital, that happened 2 weeks ago. So the timing of it, that's what stresses me out. But that was all incredibly clarifying. Thank you so much for speaking to us this evening, Oliver.
Thanks for having me.
Cheers. I'm just going to have a look at my screen in here. Oh, going to go straight on to... Oh, no, I have got a story. Not a story, a comment. Martin John with a tenner. I'm a self-employed musician, DJ and music producer. I'm due to lose 50% of my monthly income because of gig cancellations. No support has been given to the self-employed. It is completely disgraceful. I just think it's a bare minimum demand. I think people disagree about, should we have this restriction, should we have that restriction? I think this is a complicated issue. And the science isn't always completely simple. It does seem that the scientists are sort of really stacking up on one side on this question. But regardless of your position on that, I think if you have restrictions, if people are stopping going to pubs and clubs, you just have to replace people's income. There should be no debate there for me. Before we go on to our next story, please do like the video if you're enjoying it. It's a way to help the channel, and it's free, of course. Just have to hit that little like button. Next story. Former Prime Minister Tony Blair has been on talk radio with a message for the unvaccinated. Let's take a look.
Frankly, if you're not vaccinated at the moment and you're eligible and you've got no health reason for not being vaccinated, you're not just irresponsible. I mean, you're an idiot. I'm sorry. I mean, that is, truthfully, you are. I mean, because this Omicron variant is so contagious. If you're unvaccinated and you're in circulation, you're going to get it. And that's what's going to put, that is going to put a lot of strain on the health service. I mean, almost half the people in the ICU are unvaccinated. And then it's really important. We shouldn't target these people who are unvaccinated in a heavy-handed way, but we should be trying to go after them and persuade them, maybe all sorts of reasons. But honestly, it is in their own interest, never mind the public interest, for them to get vaccinated. And then finally, we've got to redouble the efforts to get vaccination out into the third world.
If you haven't been vaccinated, you're not just irresponsible, you're an idiot. Dalia, is this smart public health messaging from Tony Blair?
I hate this. First of all, he's probably one of Britain's most unliked, unpopular, untrusted public figures in the political landscape. So he's unlikely to be convincing anyone of anything. But secondly, of course, it is deeply frustrating to think of people being unvaccinated by choice, especially when you think that so many people in the world are not able to access just one dose of the vaccine. And then you have people here that are refusing to get vaccines that this country has essentially hoarded from the global south. But the fact is that people don't respond to shaming and coercion like this. You're actually more likely to turn someone who's maybe a bit hesitant to get the vaccine, but is convincible. You're more likely to turn them into an outright refuser where they dig their heels in using these kinds of tactics of shame and coercion than you are to actually convince them to get the vaccine. We know that people are more likely, for example, to be responsive to education from their families or their friends. And that's because there's a sort of undergirding element of trust and love there, rather than sort of punishment and shame. And so when we're actually thinking about overcoming the lack of trust and overcoming that hesitancy, we need to think first of all of effective public education. I think especially amongst younger people who sort of think, oh, even if I get COVID, it's fine, I'm not going to go to hospital. We need to make it clear that there is still a reason to be vaccinated, not just to prevent transmission, but also because it is not true. It is not the case that young people are safe from COVID. Increasing education on long COVID and the unknown impacts of COVID on people, even if they're asymptomatic, and the fact that, for people, I often say, when people say, oh, you don't know what's in the vaccine, you don't know what it's going to do to your body long term, I always say, to be honest, you don't know what COVID's going to do to your body long term. It's a much more unpredictable sort of unknown than the vaccine. Second of all, we need to have open and shame-free forums where people's concerns can be properly addressed, especially for those communities who have a historic mistrust of the establishment, including the medical establishment in this country, and people who haven't been listened to by doctors and medical professions, people who have been neglected, whose health has been neglected by the medical establishment. And so, don't trust the vaccine or feel hesitant about it, or don't believe necessarily people who, for whatever reason, and it's not because they're stupid, it's often because they might have some kind of medical trauma, who don't believe that the state is interested in their well-being. I'm thinking, for example, of undocumented people. Undocumented people are being told, you can be vaccinated without the threat of being turned to the Home Office. But in a country where, homeless charities are sharing data with the Home Office, in a country that's just passed the Nationality and Borders Bill, you can't really, is it completely unreasonable for them to feel a bit unsure that they can really trust that messaging? It's not unreasonable. It's deeply unfortunate and it's deeply concerning, but it's not unreasonable. And I also think that the way that we can rebuild this trust is by not having the government continue to gaslight the population on the topic of COVID. It is not unreasonable for people to look at the way the government is acting, hosting Christmas parties when we're all being told to isolate and all being told to quarantine just before Christmas last year, things like removing the working from home mandate, telling people, oh, you can't go and visit people, your friends or your family, but you can get on a tube and go to work. Things like that, not offering support for people isolating, telling us one thing essentially and doing something else. It's not surprising that some people are going to look at that gap between what's being said and what's being done and be suspicious, right? And be suspicious of other messaging that comes out of that. And that fracturing of people's reality, where they are being, as I said, they're being told one thing and they're seeing and experiencing something else. That's the gap where conspiracy theories, where lack of trust, where all of these things that give way to vaccine hesitancy, that's where it flourishes. And that's on the government. That's on the people who are, creating this mistrust through their actions, through their behaviors. That's on them. It's actually not on individuals who are responding to that with hesitancy. As much as we might be frustrated, as much as it might spark a real reaction in us, I have family members that are concerned about it, but we need to try and figure out to act not from emotion and not from stigmatizing people, but actually from what works, which is good education, open forum where people's concerns are addressed, and rebuilding people's trust when it comes to messaging and information, particularly on COVID.
Yeah, they're all really good points. I saw a tweet that went viral, I think it's this week or last week, that I really liked. It was from someone who worked at a vaccination centre, either a healthcare worker or a doctor. And they were saying, look, if we're all talking about people going to get their boosters, but if you haven't had your first dose, you're kind of the most important person to turn up. And no one is going to say, oh, why have you only just got your first dose? Everyone's going to say, oh, this is brilliant, great, have your first, they're not all going to stand up and give you a round of applause, but they're not going to make a deal out of it. Everyone is going to be delighted to see you, essentially, if you're getting your first dose. So the point that this doctor made was, don't feel embarrassed. All we want you to do is come and get your vaccine. And I think that message from Tony Blair, doesn't really accord with that. I can't see that persuading anyone whatsoever. Let's go to some comments. Tad Cantwell with a tenner, thank you so much. Speaking of the man who persuaded Iraqis into a democracy. Yeah, he did persuade quite a lot of people to go into that legal. So, I mean, he is a man who has persuaded people of some things, but maybe he's, I mean, you can't persuade people with bombs. Matthew Carberry with 20 quid. A year ago, organising a rent strike, I met an incredibly brilliant person who got me into Tisky and Novara and has made my world glorious and hoped for ever since. Cheers, Michael and co, for keeping us entertained and informed all year. That is such a lovely comment. That has made me, that's made my Christmas so far. This is almost as exciting as when I found out that I'd be able to leave my house potentially in 2 days' time. Wicked. Thank you so much for that. Let's go to our next story. The Omicron variant threatens to overwhelm Britain's hospitals this January. But the truth is, Britain's health service has been overwhelmed for a long time already in terms of waiting times for emergency care, operations and cancer treatment. 2019, the winter of 2019, was already the worst on record. That was, of course, before coronavirus. For me, this is an argument for funding our health service properly. However, when it came to solving crises in our NHS, LBC's Nick Ferrari had another idea.
As we now know, the provision of NHS care, whether it's in hospitals, whether it's in clinics, whether it's at your GP, they are bouncing on the bottom at the moment because of COVID. It is time for radical action. And today I propose to you that you all have 12 appointments per annum, okay? Which obviously works out at one a month. After that, you will be charged, unless it is a desperately serious case such as cancer or whatever it might. Obviously, that means all bets are off, you go into a different bracket. But if you constantly come along and say, I've got a bump on my bottom, or I've got earache, or I don't know, I don't feel well, I don't think I can go to work, whatever it might be, the myriad of complaints that confront those poor men and women, the army of GPs, you'll effectively get one a month free, after which you'll be charged somewhere in the order, probably about £50 to £60. It will not be means tested. That will be the end. If you do not attend an appointment, by the way, that will count for 3 of your 12, and you'll be fined £100 for not making an appointment. Unless you call and say, I'm stuck in traffic, or whatever, had cheese and wine party at number 10 and I just can't get away because we're all in suits, then you will be permitted. But if you don't, you'll be fined £100 and you'll go down to 9 a year. Now, that's my plan.
I have to say, on one level, I found that kind of entertaining just because he'd come up with all of these figures himself. They'll be fined £50 or £60. And if you miss an appointment, that will be free from your, it's all sort of like, how long have you been playing God for this morning, Nick Ferrari? But obviously what he's suggesting is disgusting. So he's suggesting you should only get one free GP appointment per month, and anybody beyond that you'd have to pay. What I found probably most distasteful there was when he said, it will not be means tested. Just in case you were wondering or doubting that his intention here was really to punish the poor. As you can tell, my instant reaction to that video, very bad proposal. It's not how we're going to solve the crisis in the NHS. I also wanted to know from someone who knew more than myself, so I sent the clip to my sister, who is a doctor in the NHS. The first thing she said to me, that's the stupidest thing I ever heard. And then I've typed out her WhatsApp messages here, and I did think they're quite good, so I'm going to read them to you now. People with significant complex health conditions are the most in need of more appointments and probably the least able to pay. Why do we think it's the people that are using more than 12 appointments which are the issue? Where is the evidence the problem isn't people who unnecessarily use, say, 3 appointments? This is just an easy crowd pleaser. You're blaming others because most people can say, yeah, I don't use more than 12. Other assholes who use more than 12 are the problem. It's unlikely to save much money and penalise the most sick when they need it. She also went on to say, they also need to factor in how much it would cost to organise and administer a payment system before they can say it would save any money. I'm pretty sure GPs are not going to want to do that. They don't have the time, and it's unethical and against the values of working for the NHS. Finally, GPs can triage their own patients' appointments using clinical expertise. A blanket fee after 12 appointments could in theory deter people from seeking advice from GPs for things like cancer, which are more costly in the long run if they are diagnosed late. Now, I was trying to edit that down. I was like, actually, all of those points were very concise and very good. They're all the reasons why this is a terrible idea from Nick Ferrari. It would be an administrative nightmare. There's no need to think that people having more than 12 appointments instead of, there will be other people who have unnecessary 4 appointments they didn't need, and maybe there's more of those and it adds up to more. In any case, this is not where the crisis in the NHS is coming from. There is not a crisis in the NHS because people are booking too many GP appointments. Where is it coming from? Money, or lack thereof. Britain is really, really miserly when it comes to healthcare. So as a proportion of GDP, our health spending is the second lowest in the G7. So you can see this is data from 2017. The United States spends the most, 17% of GDP. They're kind of an exception. They're up there because they're incredibly inefficient and it all gets sucked up by insurance companies. Let's move down to France, which is something we're more likely to want to replicate. They spend 11.3% of GDP on health. For Germany, it's 11.2. For Japan, it's 10.9. For Canada, 10.7. And then in the UK, it's 9.6% of our GDP, which is down from 9.8% in 2013. Italy, below us on 8.8%. You can see in that graph, spending as a proportion of GDP on health has declined. That's because of a Tory funding squeeze. So this data is from the King's Fund. They said the average yearly increase in health spending for the 70 years until 2010 was 3.7%. From 2010, it was only 1.4%. And that's below growth, which means that it shrunk as a percentage of GDP. Now, often you hear people say, why are you saying there was a funding squeeze on the NHS if they rose it every year? Well, for one, as I say, it's a smaller percentage of the GDP, but also because we have an aging population, if you essentially limit increases to 1%, that's a real term cut when it comes to needs, which is why the performance of the NHS has radically declined over the past 11 years. In terms of the impact of this spending squeeze and where this puts Britain comparatively, I have for you here the number of doctors per head of the population. And again, we don't score particularly well. So the UK has 2.8 doctors for every 1,000 people. And you can see an arrow pointing to us there. The average across the 33 countries here is 3. Austria has 5.1 doctors for every 1,000 people. Germany, Italy, Lithuania, Norway, and Switzerland all have more than 4 doctors for every 1,000 people. And to remind you, we're on 2.8. There are only 2 European countries with fewer doctors per head of the population. They are Poland and Slovenia. And one final data point for you. The next chart is from the Times, and it shows acute hospital beds per 1,000 people. You can see Japan, Korea, and Germany topping the list with 6 to 8 acute beds per 1,000. Whereas England, you're going to have to wait a while and go through quite a few countries, because of the 34 OECD countries, we have the lowest number of acute beds per 1,000 people in Britain at 1.8. So there are 6 to 8 acute beds per 1,000 people in Japan, Korea, and Germany. In the UK, it's 1.8. And then we wonder why we have NHS crises in the winter. We wonder why there are people on trolleys in corridors, because we have a third of the beds per population of Germany. Dalia, what's Nick Ferrari's game here? Does he really think that we could solve the crisis in the NHS by telling people to book less GP appointments, or is he covering for something else?
I mean, his game is the classic reactionary game of divide and conquer. It's taking a crisis that everyone is experiencing, everyone is afraid of, and using it to turn people not just against one another, but against people who are more marginalized and more vulnerable. The crisis in the NHS is viscerally clear to anyone who has tried to get healthcare, especially for anything complex in the past few years. We know it's almost impossible to get specialist attention, to get specialist support. We know that GPs don't have enough time to really listen and take in the complex nature of people's health issues, that things often don't get picked up in their early stages because there isn't the time and resources to catch things early. We tend to wait until things get really bad before we can get to the position where we're in front of a specialist. And so Nick Ferrari is taking that real experience and the very real fears and anxieties that places in people and encouraging us to fight one another, to fight by implication here people with disabilities and long-term conditions who will likely require more than 12, as your sister points out, who will likely require more than 12 appointments a year, saying essentially that those people are drains on public services. It's almost a eugenics kind of logic in the way that it, by implication, frames people with disabilities as sort of drains on public services. It also is about fighting, people of colour and ethnic minorities who tend to have to, often aren't listened to by healthcare professionals, and so tend to have to advocate for themselves more, which they can take up longer amounts of time in order to get what they need from their healthcare services. So rather than directing us to criticise the kind of market logic that is infecting the NHS, even though the NHS is still technically a public service, the logic of, cost cutting, of management consultants who have never done a day's work in their life as a healthcare worker coming in and sort of applying cost cutting measures to hospitals and GP surgeries, that is, rather than looking towards those systemic issues, we're blaming, people with disabilities, ethnic minority people, working class people who will require more from the NHS than other communities. And so the irony also is that, and your sister pointed this out really well, is that when it comes to healthcare, short-term cost cutting doesn't work. It doesn't make sense. Not healthcare wise or financially. I remember once a GP was telling me about the impact that restrictions which have come in, I don't know when they came in, but maybe a few years ago, which basically meant that in a lot of GP surgeries, you can only bring up one healthcare issue per session, which again, for a lot of people, healthcare issues are interlocking. The human body is not segmented in that way. Things tend to be interconnected. And also that you can only see a GP for 10 minutes or 15 minutes at a time. And a GP that I was speaking to, who's been a GP for a really long time, said that this idea was brought in by someone who has never actually spoken to a GP, because she told me that oftentimes you actually don't find out what is at the core of a person's health issues in the first 10 or 15 minutes of you seeing them. Oftentimes it's at the end of a consultation when the GP says, okay, is there anything else you'd like to discuss? Is there anything you want to talk about? And that's when some of the most important underlying issues and information really comes out. So what this system actually creates is a scenario whereby the underlying causes of health issues aren't identified in their early stages, when they could be managed easily and, to use a crass term, but this is their terminology, their logic, not mine, but can be managed cheaply. Instead, they are left unmonitored, unaccounted for a long period of time, where they then become more serious, more complex, and need more specialist and resource intensive support. So the market logic doesn't work, it's unethical anyway in healthcare because it's not conducive to good healthcare. But it fails even on its own terms, on its own financial terms, because it's not, in a long-term sense, resource savvy to cost cut, especially at the site of primary care or at the first point of contact that people have with the healthcare system, which is GPs, opticians, etc. So really, this is why this isn't in any way a financial argument or a practical argument. It's purely an ideological one, and it's the kind of ideological one, the divide and conquer logic, which has, paid off several of Nick Ferrari's mortgages, I'm sure, because it's the kind of logic and the kind of antagonism that he has trafficked in and, built a whole career on, regardless of the impacts that it has on the rest of us, because he's not going to suffer from, I don't know, but a lot of wealthy people are likely to have things like private health insurance. It's not the wealthy people that are going to be impacted by these kinds of restrictions. So really, it's a purely ideological war. It's a purely ideological concept. It fails both in terms of its healthcare benefits and even on its financial benefits, although I don't really think that should be a kind of question in healthcare. Healthcare is about getting people better and giving people the attention they need, not about cost cutting. But yeah, it just makes absolutely no sense.
No, I just wanted to pick up on the eugenics thing in case I know everyone's getting sued left, right, and centre. But what he would say is, look, no, I'm saying if you've got a serious illness, I'm not condemning you to death, because if you've got a serious illness, you will be entitled to these well, as many GP appointments a year as you want. The problem there, though, which I mean, as you summarised as well, Dalia, is that illness isn't that simple. You can't just have a tick box of, oh, these are genuine reasons to go to a GP. These are not genuine reasons to go to a GP. Obviously, he's picked a very sort of obvious cancer. It's quite easy to tell if someone's got cancer or if they haven't got cancer. But there are so many reasons why you might need to go to a GP once or twice a month, which is very difficult to fit into a tick box exercise. If you've got chronic fatigue, if you've got lots of different interlocking health problems. And what's interesting, actually, I went to the study that sort of Nick Ferrari was doing his sort of quite horrible stump speech about. The study found that 40% of GP appointments are taken up by 10% of the public, the people who need them most. I didn't actually find that statistic that surprising. I presumed it probably would have been more because, the health of people is very, very varied. I assumed that the people who need GPs most would see them a higher proportion than that. But in any case, the medical researchers who looked into this, they weren't saying, oh, this is such a problem, we need to discourage people from going to the GP. They were saying, and because it had increased, by the way, that was sort of the topic of the study, they were saying we should look at why chronic illness is increasing in Britain. Their study was, the problem we have is chronic illness. The problem isn't people faking that they're ill. The problem that we have is societal, the kind of things that Nick Ferrari doesn't tend to, the issues that Nick Ferrari doesn't tend to platform on his radio show. Let's get to some comments on this. Alex Waterville with a $5. Are you aware that GPs are still struggling to get to the clinically vulnerable housebound people before the new targets? Thanks, Michael and the team. Really important point there. I think in many ways, well, one, they're overworked. So obviously, if GPs are overworked, they're unable to do that more sort of personalised care. I think there also has been a bit of a specific bureaucratic mess up when it comes to vaccinating the clinically vulnerable. If you're clinically vulnerable, your booster is actually your fourth jab. So you get your original schedule is 3 jabs, and then your fourth jab is your booster. But I think lots of people got their third jab sort of into the bureaucratic system as a booster, and it seems like the whole thing's been a complete mess. Quite in contrast to the rest of the booster campaign. I mean, there were 1 million people, or almost 1 million people boosted today, which is genuinely impressive. But once again, in this pandemic, there are people in society who get left out of all of those successes. Over on Twitch, Spinwoods writes, building slack in the NHS should be a huge place of emphasis for an anti-Tory coalition who are more likely to rely on short-term lockdowns over a more costly long-term increase in costs via staff and sick pay increases. Really important point there. And it kind of feels in a way that the Tories are making that, because by constantly highlighting whether or not hospitals are going to collapse, they're constantly saying, oh, hospitals are on the brink of collapse. Like, maybe you should fund the hospitals a bit more. It's kind of an argument that makes itself. Rita Marley with 449. Merry Christmas to everyone at Novara, and thanks for all your work this year. Love all your names, by the way. Thank you very much for your Merry Christmas. That's the love all your names is a reference to a row that occurred on Twitter that you probably don't actually need to know about. Lots of silly things happen on Twitter. Michaela Lizardo with a $5. Caught a snippet of Tisky Sour on Today in Focus, which is the Guardian podcast this morning. Quite unexpected. I saw someone mention this on Twitter today. I'm going to actually check that out tomorrow. I wonder, apparently they got a snippet from Tisky. I'm not sure which one it was, but thank you for that tip-off. Let's go to our final story. I'd call this a good news story as well. It's been an absolutely disastrous month for Boris Johnson. There has been headline after headline about rule-breaking Christmas parties in Downing Street, or summer parties in Downing Street, all during lockdowns. His backbenchers have also given him a black eye in the House of Commons over vaccine passports, and he's dithered in the face of Omicron. He hasn't really looked like he's in control. So a slide in his approval ratings probably didn't come to the Prime Minister as a surprise, though the extent of that slide might have done. These look really, really bad for Boris Johnson. So when asked, this is YouGov, by the way, when asked, do you think Boris Johnson is doing well or badly as Prime Minister? An overwhelming 71% of respondents answered badly, and only 23% thought he was doing well. So 71% say badly, only 23% doing well. Now, that is the lowest his approval rating has been since he became Prime Minister in 2019. And as the Times point out, who I think jointly did this poll with YouGov, is pretty close to Theresa May's ratings in the week before she was forced to resign. So this is the kind of territory where it's difficult to continue in your job. The breakdown of these statistics is even worse for the Conservatives, because older people who make up the majority of the Conservative Party's support think worse of Boris Johnson now than they ever have. Now, these statistics and the change in them is quite extraordinary. Right now, for those over 65, only 35% of people, 35% of people over 65 approve of Boris Johnson as Prime Minister, down from a high of 85% in March 2020. So 85% of people in that age category approved of him in 2020, now down to 35. 63% of people actively disapprove of him who are over 65. For people who are aged between 50 and 64, 71% think he's doing a bad job. Again, a key demographic that usually swings Conservative. And the Tories will also be eyeing the north of England, which was obviously the route to their majority in 2019. There, Boris Johnson also very unpopular. So 70% of people think he's doing a bad job. 26% think he's doing well. That's not the only bad news for Boris Johnson, because while Keir Starmer's ratings are not exceptional, they are improving. They're moving in the right direction. So 51% of people still think Keir Starmer is doing a bad job, but that has fallen. And 28% think he's doing a good job. That is rising. So as I say, they're not exceptional, but they're moving in the right direction. Boris Johnson's are moving in the wrong ones. And then when we look at voter intention, focal data, their polling suggests that Labour is widening its lead. Labour on 41%, the Conservatives on 34%. And the stats for lefties, who work with Novara media sometimes, they think Labour would get 301 seats compared to the Conservatives' 252. I'm going to go to a comment. Saul with a tenner. Can you wish my brother Jamie and his family a happy Christmas? Of course I can. They live in the Czech Republic and Jamie's a Tisky Sour regular. Hi, bro. So happy Christmas to Jamie and your family from your brother Saul, who is also a regular viewer, often in our comments. So thank you for that as well. Dalia, pleasure speaking to you this evening. Have a wonderful Christmas. Thank you so much for keeping me company throughout my isolation. I think it's made it way more tolerable than it would have been. And thank you for keeping us company throughout this year. We might do a sort of stream before New Year, depending on what's going on in the world, or what we plan to do. But this will definitely be the last show before Christmas. So have a really good one. If you're in isolation, all my solidarity to you. I've still got loads of people on my Instagram and my Twitter who are testing positive now. So they're spending this Christmas alone. I hope you find some way to entertain yourself. And I am pretty confident that next Christmas will be better. This Christmas was better than the last, and next Christmas will be better than this one. For now, happy holidays. You've been watching Tisky Sour on Novara Media. Good night.